Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Here's the headline on Federal Times. Senators implore VA Secretary to keep community care access for veterans. Now, this has been a hot topic over the years and has continued to get hotter and hotter with efforts from the VA, efforts directing their staff to not make it easy for veterans to obtain community care, try to drive them into the VA. These were conversations that were had internally at the VA. We had way back when the Choice Act that went into place. Then we had the Mission Act, which bolstered up the ability for veterans to choose community care in lieu of VA care if there were certain requirements met, such as, and I might mess it up here because I didn't pull it up. In fact, let me pull it up real quick and I'll be right back. All right, I'm back. That was painless. All right, so eligibility requirements for community care. Let's read what they are specifically from the VA on their website. So to be eligible for community care, you must meet the requirements listed here. You must meet both of these requirements. You are enrolled in or eligible for VA healthcare. So you must be part of the system, right? Next one that you have to have is you have approval from your VA healthcare team before you get care from a community provider, except in certain cases like urgent care or emergency care, right? Moving on, goes on to say, and you must meet at least one of these requirements. And there's, looks like seven different ways, right? So you need a service that we don't provide at any VA facility. You live in a state or territory that doesn't have a full service VA healthcare facility. You live in Alaska, Montana, North Dakota, South Dakota, or Wyoming. Or you qualified under the 40-mile distance requirement on June 6th, 2018, and live in a location that would still make you ineligible, or that would still make you eligible, under these requirements. So they're talking about the 40-mile distance from your VA care provider, whatever it is, right? So distance requirement. You can't, the next one, you can't provide, not you, we the VA cannot provide the care you need within our standards for drive and wait times. I want to say off the top of my head, and I don't see it on here, that it is a 30-day or a 20-day wait time for general care. Not specialty care, just a general thing, 20 days and a 30-mile drive time. So that's the other one. The next one is you and your provider agree that getting care from an in-network community provider is the best medical decision for you, right? And then the last one, we can't provide the service you need in a way that meets our quality standards. Now, as far as your timeline is concerned, let me scroll down to that. So drive and wait times. Okay, here you go. This is probably most people are going to be in this boat unless you obviously live in those states, Alaska, Montana, North Dakota, South Dakota, Wyoming. So drive and wait time standards for primary care or mental health. You need a primary care or mental health appointment, but we can't provide you with an appointment at your VA health facility that's within a 30-minute average drive from your home. So traffic could be a factor. Or we can't schedule an appointment for you within the next 20 days. In each of these cases, you're eligible to get primary or mental health care from an in-network community provider. For specialty care, they push those out a little bit if you have specialty care such as cardiology, for example. So it says that if they can't schedule an appointment for you at a VA health facility that's within 60-minute average drive, again, traffic could be a factor, or we can't schedule an appointment within the next 28 days for that specialty care. is how you would be able to be eligible for community care. All right, so senators implore VA Secretary to keep community care access for veterans because it seems as though the VA is not making it as easy as they should for those that qualify. I don't have actual proof, only people who have actually said, hey, look, I had community care, now I don't, and this really sucks, specifically for mental health care. You might have a counselor that you've been working with for the past year and a half, 2 years, 5 years, whatever, and now they just pull the rug underneath and say, sorry, you can't see that person anymore. You got to come to the VA and see a VA provider. So let's read through this, see if we could overturn any stones, find some nuggets, and so forth. All right, so hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. The ranking member of the Senate Veterans Affairs Committee urged Department of Veterans Affairs Secretary Dennis McDonough to address a policy that he said is making it difficult for veterans to receive care, according to a June 25th letter. As ranking member, Senator Jerry, it says Jerry Morgan, I'm pretty sure it's Jerry Moran, led 19 other senators who asked McDonough to ensure veterans' right to community care, a program the VA utilizes to connect veterans to health care through local providers. The senators claim that a panel dubbed the Red Team, meant to assess the reasoning behind the community care's increased spending, made recommendations that are negatively impacting veterans in need of care. Wow, that's horrific. So a panel dubbed the Red Team that was meant to assess the reasoning behind the community care's increased spending made recommendations that are negatively impacting veterans in need of care. Wonderful. VA leaders, including yourself, addressed the Red Team and provided it with select data and briefings that contributed to the conclusion that frames community care as a potential existential threat, I can't say it good, whatever, to VA's direct care system rather than the vital lifeline it is for veterans and the VA, the senators wrote. So the Red Team, which was supposed to give all this kind of feedback and look for ways to address the community care costs, basically said, look, VA, you're going to risk losing money for the VA with all these veterans going outside of care. What you need to do is essentially reel that back in, make them come to you, so that way we don't have any sort of threats to the VA's self-preservation, right? So moving on, the letter states that the Red Team suggests that VA reduce community care referrals for veterans needing emergency, oncology, or mental health care. And I saw a slew of comments coming in regarding mental health care and that ability to seek outside care, community care for mental health was no longer available from the VA. Letters received and all that good stuff. So it is, there's a quotation here, it is unbelievable that the VA would consider leaving them with fewer options to seek needed care, the senator said in a letter. Even as the Red Team's recommendations have not formally been implemented yet, the senators write they noticed a steep uptick in reports from veterans and their families saying the suggestions are being adhered to already. The VA already canceled, revoked, or denied community care for a number of veterans, according to the letter. This is absolutely why you need to inform your congressional members if weird things happen with a federal agency or department such as the Department of Veterans Affairs. If you got denied community care that you were obtaining before for no other reason than we're just not doing that anymore, you need to let your congressional members know so our voices can be heard, right? If we don't say anything and we sit on our hands and just complain to each other, nothing's ever going to change. It's going to just continue to go down that road. So let's move on. VA issued a hiring pause in February and is striving to reduce staff by 10,000 employees on the VHA side, primarily from what I could tell, which is the Veterans Healthcare Administration, which the letter argues will affect veterans' welfare, especially for those in need of care. I agree, and I'm baffled by the reduction of 10,000 attempt by the end of the fiscal year. The VA's plan to do that, by the way, and I've covered this too, is, we're just going to do it through attrition. We're going to let people quit, get fired, retire, whatever it is. As they leave, as they attrit, we will not replace them, and eventually we'll get to the 10,000 less employees. Well, that's 10,000 less employees nationwide that are serving us, the veterans, right? And meanwhile, we've opened up the ability to enroll in VA healthcare to more veterans than ever before. So I don't understand the rationale behind this staffing issue or staffing reduction. And then you couple in a higher demand, a higher inflow of veterans into the healthcare system. You reduce down the number of healthcare providers at any level, not even healthcare, workers in the healthcare arena for VA. It takes the HR worker and the IT worker just as much as it takes the physician, right, to run that big ship. Now, let's throw in there the next caveat to it all. Let's stop sending veterans to community care and pull them back into the fold on top of that. I just don't see this as a good recipe for success, customer service, quality of care, reduced time frames. I just don't see, the writing seems to be on the wall to speak contrary to that. So anyway, moving on. The letter cites the VA's 2018 Mission Act with the goal of giving veterans more options for health care access that included the community care program launched in 2019. VA must embrace both the spirit and letter of that transformational piece of legislation to ensure this does not continue. The senator said, doing anything less is detrimental to the progress VA has made through the Mission Act and a personal affront to veterans across the country. And that's how it ends. I would love to hear from anybody who has had community care in the past and has been, derailed from community care by the VA, and kind of what that looks like, why they did it, why the VA said that they were cutting you off, and so forth. So with that, it's good to be aware of what's going on out there. Thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.